When injecting the canine and feline stifle, we can either position the animal in lateral recumbency, or it's usually easier to have them in dorsal recumbency. In dorsal recumbency, both knees are presented to you and they both tend to be in a nice flexed position. Our landmarks are the same. We have bony tip of patella, tibial tuberosity. What we're going to do is we're going to come in with our needle halfway between those bony landmarks, and I like to keep my fingers on the bony landmarks as I inject. Halfway between, just lateral or just medial. Determining whether I go medial or lateral is usually determined by either, if I'm right-handed and I'm in this position, this would be easier right now, lateral. But if radiographically there was a lot more pathology on the side of the joint, or sometimes you can get a lot more medial buttressing, or if they've had previous surgery, they could be a lot more scar tissue. That will determine which approach you might go with first. Either way, halfway between your two bony landmarks, just to the side of the patellar tendon, you're going to come in with your needle perpendicular to the skin. Once you're through the skin, angle proximally and a little bit towards the midline. Now your target is basically here, in the intercondylar space. So now with the patellar tendon removed, same idea. Halfway between, just to the side of the patellar tendon, perpendicular to the skin, now we angle the needle proximally and a little towards the midline. So when we inject, the tip of the needle should end up between the condyles. We don't want to be too deep, especially if you have a tiny dog, it's easy to go through the back of the joint. So you actually want to bump into bone, preferably in between the condyles. Too proximally, and you can actually be on the bone that's weight bearing, so that's why this is the best spot to hit back here.